Hello, I'm So-Jeong Kim from Seoul National University, JW Center for Global Medicine, and a presenter of this qualitative study, Parenting Experience Among Caregivers of School-Aged Children with Severe Congenital Heart Disease. This page is our main findings. The main themes from the interview with caregivers of children with CHD are passive trust to the physicians, relief by sharing experiences with parents with severe CHD, and difficulties in rehabilitation and follow-up care. Therefore, we conducted that social support system for caregivers need to be established for sharing parenting experience and information for rehabilitation and follow-up care to decrease caregivers' parenting burden. It is well known that caregivers of children with CHD are exposed to greater parenting burden, causing long-term health deterioration. However, few studies have identified caregiver-specific experiences on parenting children with severe CHD. Therefore, this study aimed to qualitatively investigate the parenting experience among family caregivers of school-aged children with CHD in South Korea. In-depth interviews were performed with 5 caregivers of our patient who visited the Department of Pediatric Cardiology at Seoul National University Children's Hospital. Interviews were conducted based on a semi-structured questionnaire on patient-physician relationships, emotional relief, and follow-up care. Data was analyzed using thematic analysis. The first theme derived was passive trust to the physicians. After their children were diagnosed with CHD, caregivers had no option but to trust the physicians in state of shock and confusion and information asymmetry as varying on authority. They expressed, because it's an unfamiliar field and I don't know the medical terms and how the surgery was going, so I just had to think as doctor told me. In such cases, the physician's attitude showing confidence and responsibility were helpful to ease the concern of the caregivers. The second theme was relief by sharing experiences with other parents and caregivers of children with severe CHD. One of interviewees said, "Even if there is not direct communication, I feel kinship just by looking and knowing that there are other patients and their parents. Because I have a sick child too, and since they have experienced it before me, they were relieved and felt kinship by sharing experiences with other parents whose children had different CHD prognosis." The last theme was difficulties in rehabilitation and follow-up care. This occurred on follow-up care between physicians, and unclear and vague guidelines confused caregivers, leading to difficult follow-up medical care and management. Most of the interviewees experienced such disagreeing opinions between physicians. For example, Dr. A told them their child could exercise and should exercise a lot, but another Dr. B told them not to exercise at all. Moreover, doctors used ambiguous and imprecise words for exercise guidelines, such as moderately or appropriately. These vague and unclear words further confuse the caregivers because they do not know the precise standards. The interviewees needed guides on physical activity, nutrition, and cognitive development for the overall child development after surgery. Thus, again, social support systems for caregivers with CHD children need to be established for sharing parenting experience and information for rehabilitation and follow-up care to decrease caregivers' parenting burden. Thank you for your attention and for listening to my presentation. Please do not hesitate to contact me via email to inquire about this study. Thanks a lot.